I'm Reverend Jesse Brown, your host, and on behalf of Sherry Hill and the whole CEFN family, welcome to our show. We have had a great season because we've had with us Dr. Brett Cordonic, and he has been telling us about spine manipulation and how to stay physically healthy. And I guess today we're going to talk a little bit more about what it takes to have a first visit at a chiropractic office. What do your office and what does your practice do?
Right. Well, what we always do with a new patient is we go through what's called a special screening to determine if the person that's sitting before me really needs to be in the office, if they belong there, before charging them for the time and the process. So that's always done at my expense. So we do two tests. The first thing we do is we check a person's posture.
All right, hold on a second. Let me just introduce here. Here's our intern, Dr. Q.
All right, so what we do is we're going to have him stand up. So this is Q, with whom I've never worked. And we're going to have the patient stand with their weight on both feet. And what I would like you to do is I want you to close your eyes. And if you feel lightheaded or dizzy, please open them. But bring your chin down to your chest. Bring your chin all the way up to the ceiling. And then come straight ahead. And when you think you're neutral, I want you to stop, but keep your eyes closed. Now, the reason his eyes are closed are so we can get what the body is really going through, that he's not using any cues. And what you can see, cues, that was funny. If I put my hands on top of his shoulders, you can see that my left hand is definitely higher than my right. And if you look at his head, it is definitely tilted to the side. And then lastly, his hands are way out in front of his hips. Okay, so Q, I want you to open up your eyes, but don't look. But don't move your head, rather. I'm going to change your posture. So I'm going to shift your head, and I'm going to change your shoulders here. So we're going to bring this back down. I'm going to bring your arms back. So this, in this position, you're actually more straight. How's that feel? Awkward. And I get that a lot because this is what straight would be. And now go back, shake it all out.
He's been doing it the other way for so long.
Exactly.
That
so,
to him feels like normal.
So this is his normal posture. This is what he's used to. So based on this, the likelihood of him having subluxations, which we talked about before, is high. So we're going to go to the next test. So I'm going to have
remind folks what a subluxation. What's the word?
Subluxation.
That's the one.
That's the misalignment in the spine that affects how your body works.
Okay.
So we're going to see how that is. So what I need you to do now is I want you to lie down on your belly. Okay. So face down, and we're looking to see how the joints are moving, not whether there's pain or any discomfort. So I'm just going to check his spine to see how those joints are going. If anything's uncomfortable, you let me know. So we check the bottom, and when I push here, I know you can't see it, but
I'm going to slide over to the side.
Definitely tight on the left-hand side of his hip, and then L5 above that. And then I move up the spine. You can see sometimes they jump when it's tender.
Right.
And then we go up, and we go through here, and certainly on the right side of his neck, there's lots of tense muscle fibers there. Okay. So sit up for me, please. All right, so we're going to go ahead. So we've done our two screenings, and if neither of those tests were positive, then it may be that his problem is not due to subluxations. If either one or both are provocative, well, then the likelihood of subluxations is high, and we would talk about doing an evaluation. Now, we know his posture was off, so definitely doing an evaluation would be a very good idea. And what that would consist of would be chiropractic tests, orthopedic tests, neurological tests, range of motion, a whole bunch of things to find out where the subluxations are, get an idea as to how long they've been there, so that we can come up with a plan to work on correcting the problem. So what I have here is I have the chart that shows basically what my care plan goes through.
Okay.
And the number one thing is always education. We always want to make sure that we're not just working on the patient, we have to make sure that they understand why they're coming in and how their body works. Because the more someone understands about why they're there, the better results they get. So we always do workshops, things to give them more information about how they can best help their bodies. Once we're working on and make sure that education is a priority, then certainly the chiropractic adjustment, moving the vertebra to get that interference from the brain going down to the nervous system, so make sure that the body can do what it does as best as possible. With that, sometimes we use massage therapy. I have certified massage therapists that work with me. In addition, we do some other modalities. There's electric muscle stim.
Hold on one second, though. On the massage therapy, that's usually something that's done over and over again. In other words, you have to usually have more than one visit for that to be effective, correct?
Well, when we put it all together and we figure out what the patient needs, Sometimes they need to come in once a week. Sometimes they need to come in 3 times a week.
Okay.
Sometimes it's like going to the gym where it's repetitive for weeks upon weeks. It depends upon what their evaluation would show. So I can't tell you exactly what he would need until we would go through those other tests.
Okay.
But absolutely, we do use massage on every visit. On most visits, we're also using some sort of therapy, whether it be electric muscle stim or some traction, or my favorite, the dry hydro massage, which is lying on a waterbed, which helps improve the circulation, which helps with the healing process.
Okay.
These things all help with the visit.
We got a couple of minutes here. Let's see if we can go through it. What is the electric muscle stimulation, and what would that be used for?
Whenever there's subluxations, a lot of times there's irritation to the muscles that support those joints. So when that irritation is chronic and it's there all and on, we need to calm that down. So we take some electrodes and we put them on either side of the spine, and then we use the muscles, the electricity, to get rid of inflammation and decrease that spasm so that the joints will move a little bit easier when we go ahead and do the adjustment.
Okay.
To go in further with the traction, most people walk around with their heads so far forward that there's extra pressure pushing down on their spines from texting and all of that with the telephones. So we want to give some neck traction to try to open that up. And some of the exercises that we're going to go through will show some other ways to do that. The same thing with the lower back. The special tables that I have in the office, we're able to lower the legs to stretch out the lower back. Takes more pressure off
it's like
the
a
joints.
waterbed thing.
That last one is the waterbed.
Yeah.
It sounds like a washing machine,
right?
but it's a waterbed. It's very nice. It's very relaxing, and it just gets those muscles to loosen up and gets the blood flowing, which really helps to calm things down with the adjustments. As we get through here, exercise prescription. We talked about how you can ride your bike without having all that pain. So there's always exercises to help with the posture and to help with getting the body to work better, how to stretch, and then certainly we need to get to strengthening. And then if we do all this but we don't modify how they do things, the problem's going to come back again. So would I love to see Q 3 times a week for the rest of his life? Absolutely. I've got girls to put through school. But it's all about really just trying to get them to change their habits. Change their habits on an effort to create what I call the toolbox. At the end of a program of care, someone should have enough tools to where they can manage conditions on their own. I don't want them dependent upon me, on chiropractic, or on anything that I've done. They need to be able to learn how to handle things on their own. So we want to get them to the point of having that toolbox.
All right. Well, that would be a great thing. But, changing any habit is not an easy process.
That is for sure.
And I know from having worked on tobacco issues and actually wrote a curricula to help people quit smoking, I know how difficult this process is in getting people to make this a habit. But this is important. People do need to make the changes that are prescribed a habit.
Correct. And unfortunately, it takes 90 days to create a habit, good or bad. The bad ones take a little shorter, I think. But
I think so, too.
To make changes, it takes a long time to get that done. So that's where repetition comes in.
But then that's part of the mission of this show, is to give people a idea of what they can do and how they can participate in raising their own health level to a higher thing. Well, I'm in for all of these things because I do the exercise. I really do try, and I try to exercise often. I also change my exercise. It gets kind of boring to do the same thing all over again, and sometimes you want to do different things on this. So let me tell my audience that we have had Dr. Brett Kordonic as part of our program on this season. He's been magnificent in giving us some tips and some things to stay healthy. You can go to the CEFN website, that's CEFN.org, and get more on him, his practice, and you'll see some other things come up because he's going to show us something in the exercise portions too.